Commissioner Tomes. Commissioner, thanks for being on tonight.
You bet. Thank you, Dawson, and thank you, Jayme from the Amateur Sports Commission and MYAS, and certainly, thank you to all of you for coming together and the Basketball Alliance. I think it's something that's sorely needed in Minnesota, even pre and post COVID and pandemic conditions, and I hope that a lot of the work that's taking place now and that we've seen with the Amateur Sports Commission and just bringing kind of youth athletics together even tighter across, a variety of sports. I really hope that lives long beyond COVID, because I think there's a lot of opportunities and benefits for the young athletes related to just that guidance that we receive from each other. Wanted to give you just a little bit of background. All of you are probably familiar with it, but just to share a little bit in terms of where we have been and how we got to where we currently are. As Dawson said, like many of you, I've been involved in youth athletics, high school athletics, college athletics for a very long time. And bless you. And remember, really vividly last year, spending some time at the Mountain West basketball tournament. And then the next day it felt like, our world was changing dramatically, and it did. And things closed, and we had mandatory stay-at-home orders, not just in Minnesota, but across the United States, somewhere, March to June. And I remember thinking in those times, certainly with my kids, who I have a couple young kids still that are really active. And I remember, just thinking, we're out at a playground and we're playing and just, really longing for some of the things that we used to do and just really missing it and kind of thinking, wow, if we can only just, get back in the gym. At that time, health and fitness clubs weren't open. Certainly youth athletics aren't open. The governor asked me, I'm a part of the governor's cabinet and have served really as kind of the engagement person related to youth athletics, as well as the health and fitness sector. And both of those go hand in hand to some degree. We convened a really large group that came together with tremendous leadership from the Amateur Sports Commission and folks like Dawson and just people from all different types of sports that helped craft together a plan to resume organized sports. And that led to sports in June resuming in Minnesota on an individual basis, relatively small groupings of people. And it was really geared towards let's see how we can learn how to play in these pandemic conditions. Let's see how we can learn how to do individual things while keeping athletes safe. And while we're learning as coaches and administrators and as associations and organizations, what is this going to look like? Because none of these activities for quite some time still are going to look exactly like what we wanted them or what we remember them to look like. And I think that's an important mindset to have, is that, that season that we had last year or 2 years ago, that's not returning this year. We can do a lot and we can certainly provide an experience that athletes, I think, will really enjoy, but it's just not going to look 100% the same as it has in the past. Somewhere mid to end of June, we were able to, as people really rallied around the stay-at-home orders and what impact that had on the spread of COVID in Minnesota, we were able to expand to allow really the resumption of games, increase the pod size a little bit and allow the resumption of games both in an indoor and an outdoor setting. And it had a lot of rules and ramifications. And for this, audience, for those of you that are familiar with it, I think by and large, we did really well in Minnesota related to the tournaments and things that we were operating. Little bit different rules in different places. MYAS tournaments had slightly different tournament guidelines and rules than AAU tournaments, but the temperature checks, emptying gyms out, keeping capacity low, masking requirements, really allowed us to resume team activities in a way that was relatively safe. We certainly saw outbreaks. We certainly saw some of the things that I think are still within our control. We had athletes that participated in games that probably shouldn't. And I'm probably going to end up saying that this, 4 or 5 times. One of the biggest things that we can do as administrators and associations and organizations is just help our athletes and our families understand that sitting out 2 weeks individually, is a whole lot better than an entire team having to sit out for a even prolonged period of time. And you know, in the summertime, we had instances where athletes either tested positive for COVID-19 or were in close contact, should have quarantined. And sometimes that, you know, for them meant, well, I won't play with that team, but I'll go play with another team. Quarantine means quarantine. It's 14 days. It's 14 days from everything, and you can't test out. And I, you know, don't think that we have done an effective enough job of messaging you cannot test out of quarantine. Once you've been determined to have an exposure to someone that tested positive, that quarantine period is 14 days. And if you take a test after 5 days and that test is negative, it has no impact on the length of that quarantine. It may give you and your family peace of mind. So I definitely, taking that test is an important step potentially if you're symptomatic or even if you're asymptomatic. But some of our athletes and some of our associations and some of our coaches think that you can test out of this, as well as just societal, you know, at large, and just to underscore that you cannot test out. We worked really close with the State High School League and was excited that the State High School League was able to resume sports, and all sports other than football and volleyball. Initially, those were moved to the spring. And the time period when those were moved to the spring, if you remember, was a time period where across the United States, there was, you know, really bad trending numbers. Numbers were trending really negatively in the South, in Arizona, in Florida, and different locations, Ohio. And there were probably, I lost count, but there were probably about 15 states or so that did not resume football in the fall either. Illinois in the Midwest is noteworthy, Michigan in the Midwest as well. And then a lot of the East Coast and West Coast associations also took just football and volleyball in specific because they were just deemed a little bit higher risk. Volleyball because of just the indoor, although, you know, that contact isn't incredibly close in football for obvious reasons. A couple weeks ago, the State High School League brought up a proposal to resume football in the fall, as did a few other states. Michigan reversed course as well. And that allowed for the resumption of football and volleyball now in the fall. And just recently, the State High School League kind of bookended their calendar for winter sports, which includes basketball and hockey, among other sports. So, you know, I think that's really tremendous news. And I just say that and share that a little bit with the backdrop of, I always go back to like last April and May, and, you know, the reality of not being able to do anything, and you couldn't get into a health club or a fitness club or a gym, a high school gym. There were no games, you know, and all of our kids were really struggling with activities and, you know, what can we do? And really since that time, Minnesota has made just incredible progress from a time in May where we weren't playing at all to, you know, a time now in October where, you know, we have the resumption of high school athletics and youth athletics. And we're talking about, you know, kind of a youth athletic basketball season kind of upon us. I'm going to try to wrap through a few points pretty quick, and I want to make sure I leave some time for questions. Dawson, if I could ask you, if you have any questions, maybe just post them in the chat window, and then Dawson can kind of be the MC. It'll be maybe the easiest way for us to rattle through just in case anyone has any questions. So just real quick, health measures. What does it look like in Minnesota right now from a health perspective? Our positivity rate is concerning. Our positivity rate is a little bit over 5%. I think our Department of Health team would love to see that positivity rate more at 3%. And it's kind of stubbornly stayed at 5%. It's kind of dipped below 5% just a little bit, went slightly back up. And so that 5% positivity rate, which means, you know, for every 100 people that take a COVID test, 5 are testing positive. And at times that's just a community testing event. So that's not just people that actually are, you know, feeling ill. That's just, you know, testing and community testing events. And so that 5% positivity rate certainly is of concern for Minnesota. It's kind of one of those national indicators that is of concern. Case growth is pretty significant. We have, over the last stretch here, seen pretty consistent days of 1,000 positive COVID-19 tests. And we actually don't count all of the various types of COVID tests that are taken. We only count the most reliable of the COVID tests as a confirmed COVID-19 test. And obviously we know that not everyone goes and gets tested. So the 1,000 cases per day is a number that certainly is of concern. The number of people that are responding, sharing information with the case investigation, contact tracing efforts, and I'll say a little bit more from a sports perspective is a concern in that, everyone wants to see their athletes play, and so the amount of information that's being shared, we can see that dwindling just a little bit. And it kind of goes back to, I think, just like, we're accustomed to from a concussion protocol perspective, I think encouraging our families to really be as honest as possible and quarantine kids and keep them home. And even if they feel like they have symptoms, and for our coaches, the old school, it's not necessarily old school, but this is that 1 year where, we probably all need to send a message that if you can't make it to practice, it's not necessarily going to impact what you do in games. It's not going to impact your playing time. We need to kind of really positively send that message of encouragement that says this is going to be a year where it's okay to miss a practice. And if you're not, feeling well, we'd rather err on the side of caution. Our community spread percentage in Minnesota, I don't know exactly what the number is right now. So I'm just going to, kind of roughly estimate at it. It's about 40%. And that means that when someone tests positive for COVID-19, they have no idea where they got it from. And that 40% number certainly is a concern. And then our hospitalizations are on the rise. And that probably, amongst, all these indicators are concerning, but the number of hospitalizations related to someone that tested positive for COVID-19, not necessarily ICU, but just a hospitalization stay is rising, and certainly we see that outcomes are better for people when there is sufficient healthcare capacity, when people that need ICU care can get into the ICU, and we've been fortunate in Minnesota that we've had that capacity, and so we certainly keep our eye on that very, very closely. One of the things as the fall has started that is unique though, and certainly it had an impact related to the state high school league decision initially related to football and volleyball, and it certainly has an impact to the work that we do here from a basketball perspective is, kind of our collective goal and priority is that schools are able to stay open. And so we just absolutely prioritize and want to make sure that we are not putting schools at risk. And that's, a little bit the fan aspect that is unique. There is a Department of Education provision, I think it's called Safe Schools or something to that effect, that limits visitors to schools, non-essential visitors to schools, and obvious reasons. People that don't need to be there, we don't want them there, just to make sure that schools have the least movement and risk as possible. And that is why, at least right now, the fan component for indoor volleyball, high school volleyball, is the way it is. And everyone recognizes kind of the disparate aspect of that, and that youth sports have had fans, and that, some of these outside activities, and we're working, really hard to reconcile and bring those two things together. A couple of things that we're seeing, just from the good and the bad. As I mentioned, I think our sports community by and large has rallied together and is trying really, really hard. Everything from health screenings for our athletes before practices, temperature checks before practices, to emptying out gyms in between tournaments, mask wearing at tournaments. I think we're trying really hard, and unfortunately, it only takes a couple of bad events. We had on the girls' AAU side, we had a couple of outbreaks where teams played on successive weekends where there were some COVID-related things happening within those teams, and then that becomes kind of the thing, and it overshadows a lot of the hard work that everyone is doing. And so I think by and large, I think we're doing really well, and those guidances are continuing to evolve. A little bit on the bad side, and we see more connected now to the restart of high school sports, and maybe a little bit closer even to the restart of football and volleyball, in that it's really, really important that we understand and really support athletes and families getting tested, not getting tested with the hope that an athlete is able to play if we just don't tell anyone, ultimately, I think, is a longer term formula for us to all collectively not be able to play. And we're seeing a little bit of that. I think, that 2 weeks out potentially is, significantly better than where we were in April. And with our numbers going the way they are, I think we want to instill as much confidence as we can in health officials. And certainly when I talk to the governor, I always share with him, he as many or all of you may know, he's a former high school football coach, he's a teacher. So he gets this world really, really incredibly well. And certainly we have concerns about some of the things that we're seeing just related to not wanting to talk to case investigators or not sharing close contacts or, really just being tough even with school officials when kids have to quarantine. If you have an outbreak in a weight room and a number of kids have to quarantine subsequently, I think the best thing we can do is just lend support rather than, really fighting tooth and nail with the school administrators and nurses or others. Couple of thoughts, and then I want to see if there are any questions that have come up repeatedly for us that I think are relevant to this community as a whole. One being kind of a concept of regional play. So one of the things that we see in Minnesota, as you can imagine, is the viral activity within a county is really different. And so we have some counties that are in a complete distance learning mode. And we have, other counties and areas where things are more open. And I think as much as we can keep play at a regional perspective, the better off we are. And really, making sure that we're in tune. For example, if a high school is in distance learning mode only, then they're also not participating in high school sports. And that probably should filter down to our youth associations as well. We certainly don't want to see, those same teams from one community, come to another. It's best just to sit out those couple weeks until, those numbers improve themselves. And so just this regional concept is really, really important. The reporting and quarantining, I mentioned, and I think there's work, Dawson and Jayme, in terms of, how can we educate? I love the work that the Trusted Coaches program has done as it relates to concussion protocol and just education. And I think there's just significant work to do still with our coaches in terms of how do we manage athletes in a pandemic? How do we do that self-reporting and quarantining, and how do we stay on top of numbers, either within our associations or across, just for the good of the collective. The fan piece, and maybe I'll tie these last couple things together. Provided that there are fans at our tournaments, Minnesota, it's kind of tough because our basketball season, at least at the traveling level, is completely tournaments. Like, we don't have a concept of league play, and so it is always this intermixing of a lot of different communities, and certainly that is concerning. But I think everything that we can do to keep teams together scheduling wise and basically in and out. All of us are familiar with the tournaments that we attend where you have an 8 a.m. game and a 1 p.m. game. And so you really can't leave because it's, not quite big enough. So you go have breakfast somewhere and you go eat and you spend some time in that community and you come back and play. I think this is that year where we do everything that we can that teams play, play, game off, play, and then get out of there. And keep age groups together, try to really minimize how many teams are playing. If there is a Friday, Saturday, Sunday tournament, try to keep teams to just 2 days. Maybe run, 4th and 5th and 6th grade on a Friday and a Saturday, run, other grades, 7th, 8th, and 9th grade, or 7th and 8th grade on a Saturday and a Sunday. However you want to structure that, but keep them super close together so that, they spend minimal time and really are able to play their games. And then, certainly the emptying out of the gym in between. Right now, our capacity limits are 250 people within a facility. And I think, we're going to have to work really, really hard to make sure that we're maintaining that capacity. Some of our gyms obviously aren't big enough even to hold 250 people. So there's a square foot calculation that goes along with that. The way I kind of like to think about it is, probably like 2 fans per athlete. And then people can, teams can figure out how they want to divide that up, provided that the facility is large enough to account for that. But things like, cashless, tournament entry where we're, prepaying or pre-buying how to get in, and then just, how to empty the gym out in between games. And so we're going to have to a lot more time, than we usually did, just as it relates to how we make sure that we're staying within those capacity limits. The more guidance that we can solidify related to that, and within the traveling basketball community, I think the work that MYAS and the Basketball Alliance is doing is a fantastic body for us to kind of link to. The more guidance that exists that is pre-written that we can point at to say we run our tournaments according to these guidelines, the better people feel about them. And certainly when we have conversations with the Department of Health, having those pre-existing guidelines that they can offer an opinion on and chime in on is incredibly beneficial. So with that, I'll pause and just see if there are any questions.
I think you've answered the majority of them. I think the one from Rick from St. Paul said, why are high schools only allowed to play conference teams, but AAU is allowed to compete against other teams from all over the state? You mentioned about we need to make sure to still regionalize even within our state. Our association that are hosting early tournaments allowing spectators. So I know Chaska, Randy Olson from Chaska talked about that their plan is to cap spectators on 10 per team for a November boys event. So I mean, that's kind of in general the big difference, high school league and youth guidance kind of stuff.
Yeah, one additional thing, and we'll continue to share these things with Dawson and Jayme. I think limiting activity in the schools is really important, and so maybe think about in your associations for and I don't know where that magic grade cutoff is. I swear I feel like when I had third graders, I already told parents that they couldn't come to practice anymore. But just limiting who's coming to watch practices. Certainly when they get to 7th and 8th grade, probably 6th grade, they can drop their kids off. Kids can come to practice. They don't have to come in and watch the practices, just to support limiting activity in the schools.
Yeah, and I mean, I think we'll get into it in just a minute here with the whole thing about like Jim from OSU Maple Grove talked about their work of working with ISD 279 and really working with the owners of the facilities to understand what their expectations are and working hand in hand with them on making sure that you're doing your part and you're following through on that preparedness plan and your own guidelines.
Excellent.
So I mean, I guess the big thing that I would say, just to piggyback off of what Commissioner said, is this body of the Minnesota Youth Basketball Alliance, I think we all are committed to it. I know, because we want youth basketball to continue in some capacity. We know that we're not going to be able to see it where it was last year, the year before that. It's going to be not like that, but I think we want to continue to play games for the kids because there's a lot of benefits we know. And so we got to make sure that collectively, like Commissioner's saying, that we're disseminating information out as a body and that we are strong because of that, that we are making sure that it's coming from us as the Minnesota Youth Basketball Alliance and everybody, no matter where they are around the state, that they are following those same things. So, Commissioner, you have anything else? Because we'll move on to the next thing. I greatly appreciate you joining us and thank you for your time.
Yeah, no, I really appreciate everyone's time, and please keep the communication channels open. Certainly, you're in these spaces and connecting with these families, and so keeping the communication channels open as we continue to evolve the guidance is really important. I'll hang out for a little bit. Thanks, everyone.
Okay, thanks, Commissioner. All right, so we're gonna move on. So some of you may have met Jayme Murphy last month. He has been a godsend when it comes to kind of making sure to maintain consistency within youth sports and the guidance around mitigating the risk for COVID-19. The big thing last month was the decision tree. I just want him to share kind of an update on, I guess, the latest stuff that's been happening within sports and maybe reiterate the decision tree and talk about the stuff that, you know, again, it's up to us to continue youth sports.
Perfect. And let me put the decision tree link in the chat for everyone to see it. Dawson, if you want to give me ability to share, that's cool. Or if not, we can just kind of talk through it. So last time I presented the decision tree, it was actually released the day before our meeting, so I didn't have as much time with it as I wanted. Right now, though, I've been pointing every single person I've worked to this decision tree, because when trying to figure out as a sports organization or whomever how to deal with this virus, there's a lot of questions and not a ton of documentation, but this decision tree is a great thing to point at. Perfect. So what they've really done is, you know, let me back up. So a little bit of my history. I know some of you are familiar. My name is Jayme Murphy. I work with the Minnesota Amateur Sports Commission. I am a former Big Ten football player, a 3-year letter winner from some school down south that I'll save for later. I also have a master's in public health from the University of Minnesota. So a top 10 public health school in the country. We're in a great spot here in Minnesota, and kind of speaks to the response we've had from MDH in this administration in general. So, you know, a few things to point out with, you know, Commissioner Tomes is right. There has been a decent amount of cases. I've been working with more and more on a daily basis. I kind of serve as a consultant, whether it's with, you know, a larger sport governing body, you know, Twin Cities Soccer League, Minnesota Youth Soccer Association, working with Minnesota Hockey, work with some of the junior hockey league teams, and obviously work pretty closely here with Dawson. So a few things to point out that I've just seen, let's say, mistakes or ways we can protect ourselves and protect our sport respectively is right now, since the virus is so prevalent out there, you know, we have to be looking at the households of our athletes as a really big space where we can mitigate some of this risk. So if there's someone within your household, for example, I just got an email at 6:45 from a football group asking this. There's a mom is currently has symptoms. She is awaiting test results from a test she took today. So under the protocol within the decision tree, every single individual within that household, while awaiting results of that test, needs to self-isolate. And as Commissioner Tomes said, self-isolate means from everything. So that one's a temporary one. Until those test results are returned, you can't go to practice, you shouldn't be going to events, you shouldn't be going to social gatherings. Now, if that test result does come back negative, you'll see here at in the green, let's say at the top right, receives negative COVID-19 test or an alternative diagnosis. As we know, coming into fall, it's kind of upper respiratory illness season. People that have colds, pneumonia, strep throat, all these different things that can have kind of similar symptoms to COVID. But while awaiting test results, everybody in the household needs to self-isolate. No practice, no competition. You know, something to point out here, in the protocol, how MDH looks at these tests, looks at these positives, they look at the 48 hours preceding the symptom onset. So we're already working against kind of an unknown. There's a 2-day period where people are not symptomatic, that they are technically contagious. There's nothing we can do about that. All we can do is report symptoms, report test results as quickly as possible to those, I guess, bodies that we would be exposing that have stakes in this illness. So, you know, there's a tough part there with that 48 hours pre-symptoms. Anybody exposed, and exposed means within 6 feet for about 15 minutes, those individuals would need to self-isolate. So if you're a basketball association, say we got a kid, Jimmy. Jimmy tonight practices, everything's fine, but tomorrow morning he starts waking up with COVID symptoms, and the next day he gets a test, and that's positive. It's likely that everybody in that practice will probably have to self-isolate. You know, that's an unfortunate piece. Now there's another layer to that. You know, you got to be careful looking at the families. So while mom's awaiting test results, Jimmy should be home. He shouldn't be out there potentially exposing anybody. If she does test positive, household members have to self-isolate for 14 days. In the cases I'm working with, it's often a parent exposed at work, at some kind of social gathering, or as Commissioner Tomes said, community spread's relatively high. And community spread means cases of unknown origin. So that means about 35% of cases right now, we have no idea where they technically came from. Now part of that could be some unwilling individuals to share with the contact tracers who they may have gotten it from. We'd hope that those individuals are not part of our sports family and community. We need to be looking out for each other. So that's kind of the things I've been seeing. What I want everyone on this call is to use this decision tree, use it to make your decisions, send it out to your stakeholders, send it out to your parents when they have a question. Why are you doing this? Have it directly documented right there. And also you'll see there within the symptom tree, it lists what kind of symptoms and how many you really need to have to isolate. So if you got one of the major symptoms off the top of my head, I'm trying to think, the fever is one of them, loss of taste, a few of those. If you just have one of those, you need to be staying home. Now there's some more common symptoms like a cough that you might need 2 of the less common symptoms to stay home. Again, it's on the decision tree. Now, taking a step back, let's say you're exposed, you're around a lab confirmed case, someone who tested positive within that 48-hour time frame of them becoming symptomatic. You would need to self-isolate for 14 days, and anybody else around that was in that close contact for 14 days from your last contact. So let's say an individual tests positive on Thursday, but you were last around them on Wednesday. Your 14-day clock would start on that Wednesday. Another example, let's move forward to pretend like, and this, unfortunately is a definite possibility that you get a case. When individuals get a case, they have to be self-isolated for 10 days. So that's a 10-day clock for people that have COVID, 14 days for those who've been around it. The 14 days, why is it longer? Well, there's an incubation period. Basically, the virus has to kind of bake within inside of you before it starts actualizing, making you symptomatic and things of that nature. So it's 10 days for those who have COVID. And there's a few other considerations there. It's not only 10 days, it's 10 days on the other side. You're expected not to have a fever for at least 24 hours and for your symptoms to subside. There's something else not listed on the decision tree that conversations with MDH are recommended. We recommend that individual reaches out to their doctor, the primary care provider. See if they want to do a health screening before they return to practice. There have been some side effects of having COVID, some heart-related stuff, some respiratory stuff. It is not extremely common, but it might be worth just having that individual connect with their doctor. So again, use that decision tree, point to it from why parents are asking why you're doing something. Really have that documentation available and be really diligent. Get back in your messaging, talk about how, household exposures seem to be a really important place. And 2, schools are going right now. What I've seen, depending on the age group, and there's not going to be a blanket response, but if a kid in your athlete's class tests positive, it's not necessary, or it's not an automatic self-isolation for that kid. It'll be case by case. We'll have to work with MDH to determine what kind of exposure they have. But the general understanding and or assumption right now is that social distancing is maintained relatively well within these school settings. So the few cases that I've worked with where a classmate has been positive, MDH has not considered that individual exposed. Not saying that that's every time, but just know that there may be further consultation needed if you find out about that through the school. Another important thing, Dawson just pointed up there, there's an email listed. So if there's any questions about this process, if you'd like to get on top of the contact tracing, share more information, be a good partner with MDH, reach out to sports.covid19@state.mn.us. There's a whole team of epidemiologists answering those emails. Myself, I actually get forwarded them sometime from MDH to answer some questions. So don't be surprised if it's me answering or it's some of our great experts at MDH. And again, be diligent. If you see an athlete coming in exhibiting symptoms, having something, that just worries you. It's not worth the risk. That 2 weeks, you could stop one individual from maybe spreading COVID on your team and just having that one individual have to self-isolate versus having to worry about a whole team. I don't know about how you're looking at some other sports out there. The NFL right now, we're looking at the Tennessee Titans. They just had 6 straight days of cases upon cases. Today was the first day in 7 days that they haven't had a case. These things can spread quickly amongst teams, amongst people. And what we're really trying to do, especially with these, pod settings in practice, just mitigate the amount of people, the amount of contact outside of competition. The goal here is to be able to continue competitions, games, tournaments in some form or fashion safely. And we have to make some trade-offs, at practice and maybe the way we operate outside of sports in our lives. And, me being probably a little too intense, a little too hardcore of a sport guy, I'll do whatever it takes to be able to play and to be able to continue with competition. So, I hope that, some of you share that passion or, whether it's just the health of your organization, your kids, or just the whole sport and the state. I mean, we have a collective responsibility to continue to allow sports to go in Minnesota. We've done a good job so far. We've been a model. Almost everybody I've talked to has been a superb partner, generally curious, not that resistance. Dawson just shared my email in the chat as well, in case anybody wants any questions. So I'm just happy to help out, as a representative from the Minnesota Amateur Sports Commission. I just worry about amateur sports as a whole. As a former jock that I can't shake, I want youth sports to continue. It's really important for kids in these days to be able to have this outlet. It's a privilege to be able to have it, and we would love to continue that privilege until we come out on the other side of this, whenever that may be. And I know we're in good hands with Commissioner Tomes and the administration. We have sport allies everywhere, and we'll do whatever we can to make sure our sports are safe and work with the experts and help you do so as well. So let me know personally if there's anything we can do to help. Let me know if you have confusion or need help working with MDH. Happy to jump in there.
All right, thank you so much, Jayme. Would you answer, and then we'll move on, but would you answer Jim Davison's question, or
yeah,
what your thoughts would be on that?
Yeah.
Yep.
Okay, so it's the less than 15 minutes. And so this is something I've worked with MDH a little bit. And the general thought is it's 15 cumulative minutes that you want to avoid. However, it's possible within a sports setting that an exposure could occur with, let's say, less contact time, depending on the physical nature and position of the individuals in contact. So let's say it's less than 15 minutes, you're playing a scrimmage, but you're a center working against the other center who has COVID. He's, that individual is in the post working you all game or working you for 10 minutes straight. You could be exposed. This is something you'd want to walk through that scenario with MDH. This is one of those situations where you would want to email that sports.covid email. So no parents allowed at practices. Not everyone's happy with this. This is what we chose to do at the National Sports Center as well. I mean, just finding ways to keep groups of people to a minimum. And also only coaches and players. I think that's a good way to approach. Really interesting point. And this is something you don't have a great answer to. There was 20 Titans positive and 0 Vikings. Thoughts on how, why? I don't have a great answer for that. I mean, you know what? Football is played in a, let's say, a larger a setting with a lot of air exchange. I'm trying to think, was that game at Minnesota or Tennessee? But, what I have seen from CDC just released this today. It's tighter enclosed spaces with not so great ventilation. So I'm not specifically picking on gyms. That could be a gym or it could not. You kind of would know that setting better than I would, but that kind of just speaks to the unpredictable nature of this virus. There's nothing straightforward. It's not 1 + 1 = 2. Honestly, sometimes There was a really interesting article in the Atlantic this week, talked about how to, this is a little nerdy public health stuff, but how this spreads. And it seems like sometimes it doesn't spread at all. And sometimes there's huge super spreader events that really drive a lot. Now, what determines how that happens? We don't really know. But what seems to be has to happen for that to happen, a lot of people have to be together to get a decent amount of spread. So yeah, someone mentioned could be a flight or a bus. It could be any instance of close contact up to that. It could be a locker room. It could be any setting. Again, there's not easy answers here. Anybody who tells you there are, I would be a little skeptical. Just walk through your situation. Treat every situation unique. Use what we have documented, and then use the experts. Use the MDH email. Use myself, and be happy to kind of. Usually, when I get an email, I ask about 4 more follow-up questions. All right, when were they symptomatic? Were they around the 2 days preceding it? What position they play? How much were they playing? There's a lot of considerations to take into effect when looking at COVID and how to treat the virus.
If I could, Dawson, I was just going to chime in just real quick on Jim's question. I mean, I think Jayme nailed it, Jim. It's just not going to be, always uniform. It's going to be really setting dependent. But I think one of the things, and it could be just a positive byproduct is, really encouraging our coaches to have a practice plan and save that practice plan so that, it becomes kind of your guidepost for like, what did we do in practice and who may have been intermixing. And, some of our coaches, sometimes some of our more experienced coaches, they can conduct the practice without a practice plan, but it will help. And then just think about, how we can conduct some of these practices a little bit different than we have in previous years in terms of just, the skill work and how we group players together. In the case of the Titans and Vikings game, I think the viral load that a person has just varies so dramatically. When we look at what happened at Notre Dame, just from a pregame meal, and it, kind of wiped out almost their entire team, or, obviously the very visible, national what's playing out from the White House. We're going to have instances where players are in close contact and no one tests positive, and we're going to have, other instances where, it's really going to have a much more profound and dramatic impact.
And I'll help answer Megan's question. But another football example, and sorry to keep going back, but Cam Newton, he's not playing tonight in the Monday night in a game against the Kansas City Chiefs, and he's the only case on the Patriots. He's their quarterback. It's not always going to be straightforward. And getting back to Megan's question about how it might be exposed less than 15 minutes if you guarded a person. There will be some, it's probably not going to be a stopwatch approach. They're really going to anecdotally talk about what that situation was like. And if I'm being completely honest, it's more likely than not, if an infectious person played in a game, that most people that played in that game will need to self-isolate. Just more likely than not. I can think of examples. I had an example of, a bench player that barely got in, had a little bit of action, and was mostly not in the game. That's a situation where less people might be affected. But if you're playing in a game and you are considered infectious, it is very likely that everybody there would be considered exposed. Where we start getting in that 15-minute thing a little more might be practice, where you can kind of negotiate that. But in a game setting, it's a little likelier that you'd have to isolate. Is that correct, Commissioner Towns?
Yeah, no, absolutely. And love to take one more shot at, and this is completely unscientific and just, my personal opinion, I if you will. I think in many of the cases, in particular with the younger athletes, when we look back, there was some exposure, there was something that really could have and should have led to them not actually playing or being at that practice. And just that proactive messaging, I think, will avoid, so many of these, potential situations that we're just messaging the folks that, we'd rather have you sit out a weekend, sit out a game, sit out a practice, rather than come and then get into a situation where, we now have to make really tough determinations in terms of who all has to quarantine. And remember, that extends not just to that sports activity. That means those kids are not going to school. That means that, potentially if another kid tests positive, then there were close contacts in school. I mean, that thread, gets pulled and has a lot of impacts. And I think that message of what can we do up front, screening kids before they come to practice, checking temperatures, as they come in, asking those critical health screening questions, how are you feeling, and just encouraging folks. Maybe sometimes you don't have a player sit out, but maybe you just have them go, do some skill work on a basket by themselves for that practice. It doesn't always have to mean that they can't come, but sometimes maybe, we just take them and do some different activities. This might be the year where we get to flip the skill development versus gameplay, upside down a little bit.
All right. And I don't want to take any more time. I know there's an agenda for tonight. So thanks for everybody for listening. And again, I'm here to be an ally, here to be an asset to help you all. So let me know if there's anything I can do to help.
Jayme, answer Jesse's really quick.
Thoughts of MASC on athletes, beneficial players MASC during some of the skill development portions of practice. It's masks are always beneficial, especially on the sideline, but masks are not going to be necessarily a replacement for social distancing. So in my conversations with the Department of Health, if you are masked, but you are closer than the 6 feet and for 15 cumulative minutes, they might still, ask for those individuals to self-isolate. Now, I'm not saying that is not a potentially good way to mitigate spread. And I'm not saying it's a bad idea by any means, but it may not necessarily be a preventative when it comes to these self-isolation requests. But it might be beneficial if there is virus, there'd be some less spread. So it's not required, but with the mask order, as athletes come in and out of buildings, it'd be ideally they need to be masks. And even on the sidelines, if possible, masks would be ideal as well. So, hopefully this was really informational for you all. And again, happy to keep answering these questions beyond this call as the coming months go.
All right, Jayme, thanks so much. Again, I shared Jamie's email address. I know that he actually has a job too at the National Sports Center besides this, but he is a great advocate for, obviously, as he said, continuing to get sports on the field, on the court, everything. So we just need to make sure that collectively we're doing our part. And Jayme and I and the rest of the MYAS staff will do our part in continuing to get information out with that. So again, thank you, Jayme. Kind of turning to what Randy Olson from Chaska had said. He talked about the process that they took with District 112 and what they did with their facilities. So Rich Pennick, if I could just have you speak for just a minute or two, kind of on some ways that at the MYS, what we did for our summer tournaments and now our fall programming that were successful, and some of the things that from a format perspective that worked as well.
Thanks, Dawson, and thanks, Commissioner Tomes and Jayme for all of the great information tonight. This summer we spent a lot of time talking to the individual school districts that partnered with us to run events, and they were individual plans for their schools. And that's probably what you're going to have to do with each of your individual facilities, is to figure out an entrance and exit plan so that you can safely get people in and out of their gyms, so that they're not passing each other, like they used to be, standing at the doorway, and then we have 500 people run into the gym as 500 people are trying to get out of the gym. And what we found that in each of the communities that we ran events is that we were able to, sometimes we had to, eliminate courts. We couldn't use every court in a facility because that wasn't conducive to getting people in and out, and to also provide some social distancing within the facility itself. From there was a lot of how do we how do we group teams? And we did a lot of things this summer, and we're doing things a little bit differently here in the fall. But for the most part, what we've done here in the fall is teams are playing 2 games, so they're just going to play back-to-back games. And putting them in a pot of 4 teams and getting them on 2 courts and being able to play a back-to-back game at 8 and 9 o'clock, all 4 teams are there. They don't leave the facility. When they're done, they leave, and we bring in the next 4 teams. As we move into the tournament session, and we're going to be having a tournament this upcoming weekend, what we tried to do is to keep teams in the divisions into groups of 4 or groups of 8. So that way we can do that, back-to-back games, take a game off, and then play that 3rd game. Eliminate as much, fan interference or fan interaction. We play the 2 games back-to-back. We escort, we bring in the next group. They play 1 game, and then they get taken back out. First group of teams comes back in. They play their 3rd game. That second group of 4, they come back in, and they'll play back-to-back, and then they're done. We're eliminating that game on, game off thing a little bit to stop some interaction some more. But again, each facility, Burnsville, I'll use them for an example, complete emptying of every single gym after every game. The custodians will come in and they'll actually clean benches, anything that's in there. What we've been trying to do is have the teams be involved in helping clean the benches. That might be something that you'll want to do during the winter season as well, to help with the whole thing. I guess one of the biggest difficulties we've had is the parents that don't want to abide by wearing a mask inside. It's gotten better, but we still have every weekend, I get a report from one of our hosts that we still had parents that just want to push the envelope, and they get in and they'll wear the masks as they walk in, but they get in the gymnasium and then they take the mask off. And that's not what we need. And we need we need everybody to be on board with this so that we can, as Jayme and Tarek both said, so we can continue playing games. Doss, where should we go from here?
No, I think that's good, Rich. That's good. That's a lot of great information. I think that's something that the MYAS's job is to disseminate information and make sure you guys all are as prepared as possible with what you're doing, and just provide best practices that we can get from Commissioner Tomes in the state of Minnesota, the Minnesota Department of Health, along with the Minnesota Amateur Sports Commission, that we can get everything we need out to you. Again, one of the things that we found for spectators so far is that we were able to get to that number of 17 spectators plus 3 coaches, because in every facility that we've used so far, that has either been at around that number of the threshold, or it's been less than what their expectations are. Again, as has been mentioned in some of the chat stuff, there are other districts that have other ideas on what that maximum number is. And you're just going to have to work directly with your facility owners within your community to figure that number out. So we're going to, again, there's a lot of great questions. We'll monitor it. Jayme and I can monitor that, and we'll try to get more questions answered, but we still got a lot left. So Rich, thanks for giving some comments and feedback on that.
Hey, Doss, if I could, I'll make this really quick, but through the summer and fall, Rich did a really good job of, he basically had to convince facility managers to let us run events in some cases. We had a really good plan with our safe play back to the hardwood document, and just letting the facility directors know that we do have this plan and that we're going to carry it out. The documents that we've got posted on our website, you guys and gals are 100% welcome to borrow some of that stuff, copy as much as you want. So I know, just reading through the chat here, there's a lot of you that don't have access, or it's very limited right now. So, get a plan, communicate it to your facility managers, and make sure you follow through with it. That'll definitely help, hopefully anyway. get you access to those facilities.
All right, thank you for adding that. Okay, we're gonna transition now to another perspective or another part of health and safety. So we are now transitioning as you all are association leaders, and you're gonna get stuff out to your travel directors, which are gonna get stuff out to your youth coaches, and make sure that they're providing a safe, positive, productive environment for all your athletes within your association related to COVID-19. But there are other parts of that that we need to make sure that we are thinking about, such as a dynamic warm-up, which we know that as you get into a season and as you only have an hour and a half to practice, a lot of times coaches bypass that part. So it's very important that this information is going to be, I sent it out beforehand, but mHealth Fairview is our medical partner, and we're blessed to have Bren on, who happens to be a former collegiate, and she had the opportunity to go play professionally, but she chose to seek her professional field. But I just want her to touch base on a couple main things related to the other parts of health and safety. So welcome, Brianna.
Thanks, Dawson. Thanks for having me. So my name's Bren. I'm a physical therapist for mHealth Fairview, and I specialize in sports and lower extremity injury. Like Dawson said, I played 4 years at Gustavus Adolphus College and was honored to be nominated Player of the Year in the MYAC my senior year. So I know what it takes to be a good athlete and to keep your body healthy and strong. I followed a ton of basketball throughout my lifetime, so I've played several summers of AAU ball, high school, college. And I know that there's a huge opportunity to improve our lower extremity injury prevention programs. I could rattle off a ton of boring statistics for you guys, but I think we all know and understand how prevalent ACLs and ankle sprains are in basketball. And so my key message to you guys today is these injuries, they can be prevented or at least significantly reduced by implementing simple dynamic warm-up routines. And so we're talking pre-game, pre-practice routines, and all they take is 10 to 15 minutes to go through a full program. To work, they need to be implemented at least three times a week. Ideally, every practice, every game would be ideal to get these athletes warmed up properly. And I do have if I can share my screen, I'll just show you, and I can share this link with you. Through mHealth and Fairview, we have a system called PTRX. Can you guys see this?
Yeah.
Okay. So this link will take you to a bunch of videos that will show exactly what I think would be a great warm-up for all athletes. So to share this with coaches and get athletes doing these would significantly reduce lower extremity injuries in basketball players. So you could take this and go through the videos. And like I said, everything together should take a max of 10 to 15 minutes to get through. So maybe it's coaches just say athletes get to the facility 10 minutes early, and that's just what we do, and run through the routine, and there's no contact person to person either. So you can just warm up yourself and not have to touch anybody in the process. But these things can be extremely, extremely helpful in preventing injuries. And I think we're doing a little bit of a misservice if we're doing just static stretching and just grabbing the basketball and get going right away. I think we can do a lot better job of just doing this 10-minute simple warm-up routine. And just a outstanding stat is that there was a study done, and there was an 85% reduction rate in in ACL tears in a group of teams that implemented these versus a team that didn't. So they have been proven to work. I just think we need to do better as a sports community in getting this information out there and actually implementing it.
Okay, Bree, I mean, I think the other thing to mention, everybody has the capacity through Sport Engine or Team Snap or whatever other way they communicate with the teams, that the coaches communicate with the teams, or team manager, that everybody's looking at this. So this could be a way that you get it to your entire team so they can do their part prior to practice, like you said. So by the time practice begins, they're ready.
They're ready to go.
Yeah, they're ready to go. So,
Exactly.
I do have, Mark, I sent that prior to, but we can pass along that link again. So
I'll-
do you want to, do you
I'll
have?
send it, there it is, and then I'll put up my email address. If anybody has any questions about anything, please feel free to reach out to me. I'd be happy to answer questions.
Okay, so, Bree, thank you so much for joining. I don't mean to cut you off, but we got a lot of other stuff, and we will continue to pass along. The beauty of our partnership with mHealth Fairview is that we can get information out at any time to our stakeholders, and so we can do that for sure with all of you, continuing to get stuff out. I know this has been very beneficial for, you'll hear from him in a little bit, but Clarence Fields and our Rising Stars Basketball Academy, that Bree worked with on this dynamic warm-up and other stuff related to that. So thank you, Bree, for being on tonight. Appreciate it.
Yeah, thank you for everybody's time.
Okay, we're going to transition now really quickly. This is another thing that has nothing to do with the other stuff we've talked about, but it still is a way that you as association leaders, in order to make sure that your organization is mitigating your risk, that you do your due diligence, that you're doing some best practices from finances, from a financial perspective, that you're making sure to follow through on these things that are going to be discussed. So I'd like to welcome in Lisa. Lisa is somebody that I've worked with for the last probably year. She's with the University of Minnesota. She's got a tremendous background in the research portion of it, and this part of it is, this is a situation where they're collecting research from 4 countries. So Lisa, I will turn it over to you. I'll let you talk about it, and then I'll bring in Julie to kind of talk about best practices.
Thank you, Dawson, and thank you for the opportunity to speak with you this evening. I'm going to talk with you a little bit about COVID-19 that nobody is really talking about. One of the consequences of COVID-19, that people are losing their jobs, they're being furloughed, and they're under financial pressure. And that creates opportunity potentially for fraud in amateur community sport organizations, which it's not even on the radar of the discussion right now. So tonight, I just want to bring to your attention about potentially how this happens, and some research that we're doing globally. And then Julie's going to share best practices, just some reminders. You might already are doing these things about financial control mechanisms, but just a reminder, because we know recently, I think at the beginning of this session, Dawson talked about in Little Falls, there was a youth hockey association where $90,000 was stolen. This past summer, $100,000 was stolen from the bank accounts of a Bloomington Fast Pitch Association. And I don't know about you, but could your organization survive if you lost that amount of money? And how does it impact your participants? Probably they wouldn't get to play. You mightn't be able to buy uniforms. You mightn't be able to pay for travel, equipment, and what about facility costs? So the impact of fraud on community sport organizations, amateur sport organizations, is huge. So that's, again, why I'm here. It's my passion. Like Dawson said, I'm a professor at the University of Minnesota. I'm the director of the Global Institute for Responsible Sport Organizations, and part of that, I study corruption in sport. So I see this, read this, I study this on a frequent basis, and I know that potentially people who we respect in the community end up getting arrested for fraud in community sport organizations. So when I'm talking about fraud, the way I'm talking about it is when people use their position for financial gain by deliberately mishandling the organization's resources. Okay, that's what I'm talking about. So, and that could be forging or writing blank checks, siphoning funds off your personal accounts, creating fake supplier accounts, using their position to acquire credit cards that they use for their own personal gain or purchases. And I'm going to share my screen here for a second. Okay. Hopefully I know how to do this. Here we go. It's not going to let me do it. Okay, this will work. So I just want to walk you through how does fraud happen in community sport organizations or amateur sport organizations. If anything that you take away from me this evening is remembering this fraud diamond. It starts up with pressure. People have incentives to commit fraud. And right now, because of COVID-19, we really could potentially see some financial stresses. We also know addictions are huge, gambling, drug addictions, and then mental health issues can influence people to potentially make some poor decisions. Then there's a rationalization. People justify why it's okay to do this. There's a denial of responsibility, meaning I had no other decision. There was no other choices. I had to do this, or I had good intentions. I was going to pay it back, but I just couldn't. Or some people just believe because I spend so many hours volunteering, this organization owes me, and I'm going to take my cut. We also know it relates to capability. So who do we generally recruit to serve in the treasurer or the president's position? Somebody that has the capability, understands bank accounts, they're trained in finance. And so they understand how systems work. They also know if there's no checks and balances, how to navigate the system to potentially engage in fraud. And then the other piece is opportunity. If an organization does not have sufficient oversight or trust their members or their board members too much, there is a potential there for fraud. We never think that somebody's parent who's sitting in the treasurer position would actually steal from the organization. And those are the people that are stealing from the organization. We trust too much, and we don't follow our internal controls. So specifically in a time of COVID-19 where we have these pressures, I really want you to think about, do you have internal controls where there's checks and balances, and where that you're making sure you're reporting to your board, and there's physical reports, it's not a verbal report, and you're just not trusting people to say the money's good, because that will get you into trouble. So just remember, pressure, rationale, capability, and opportunity are the 4 indicators of how potentially fraud could happen. And the last thing I want to share with you is my colleagues and I from Australia, Germany, and Canada have been doing this longitudinal research about how fraud occurs in community sport organizations in a global context. And we were really interested about risk factors for community sport organizations. So we're in the process of collecting data, and I'm hoping I can invite you to participate in this study, where we'll just be asking you questions about your perceptions of vulnerability to fraud in an online survey. It will take about 10 or 15 minutes. You could enter to win one of 10 $100 Target gift cards, incentive, not to commit fraud, but to do good in answering our survey. Dawson has agreed to distribute the survey end of October, early November. It's volunteer. You don't have to do this. I'm just inviting you. It's strictly confidential. When we release the results in a report, it will be aggregated data and not identifying any clubs or anything like that. And when we release the findings, we'll share them with Dawson along with the report and potentially recommendations and any resources we can share if we see some issues around if clubs are vulnerable to fraud. Because the key thing is we don't want you to be vulnerable, because we want to protect young people so that they can participate. So just another thing, I know COVID, there's a lot going on, but I don't think we can afford for your clubs to be have an embezzlement situation. So I'll leave it there. I will put up my email if anybody has any questions or wants to reach out to me. But again, Dawson, thanks for letting me speak to the group tonight. And Julie, I believe it's you.
Yeah, Lisa, thank you for sharing your knowledge. And it's something good to remember that everybody has their checks and balances with that part of it. And we'll get information out that Lisa would like us to get out to all of you. We'll send it to our basketball leaders and baseball leaders so that you guys could answer that if you're willing to. So I'm going to bring in Julie. Julie Richardson has been our accountant personally at the MYAS for, I believe, a dozen years maybe. And she has had lots of experience related to working with youth sports organizations. And I just wanted to bring her on just to kind of give some best practices to think about as organization leaders related to this topic. So Julie, thanks for joining us.
Thank you for having me. I enjoy working with MYAS. I've been working with MYAS, I think it's 11 years, but so maybe this year's 12. So we're getting there. One thing, I'm going to try to do this very quickly. I have lots of personal experience with my clients have had fraud, and it's common. It's much more common than you would think. You hear the big stories in the news of the 90,000 and the 100,000 or 400,000. But there's a lot that's like in the 12,000 range that doesn't ever hit the news. So, and the other thing with that, it can happen to organizations more than once, even in with the same person. So I had someone that was stealing. I brought it to the group's attention. The board, executive board, chose not to terminate her, didn't share it with the rest of the board. She stole from them again. So you see that over and over. And the other thing to keep in mind, it is very easy to steal from your organization. You need to understand that it is very easy. And the reason why it's easy is because you're very passionate about your mission, and your mission is sports. When it comes to the treasurer position, if you find someone that's willing to do that position, you jump up and down, you're excited, and you never let them go. And no one else wants to. It's not your thing, you don't want to understand it. I can give you a few pointers that's going to really be super helpful in even in your organization where finances can kind of be not all that exciting. It's not glamorous. I'd give you some more examples, but you kind of all know it from reading the news and things like that. One of the organizations that I got involved with looking at what actually happened. It was a hockey association. Your dollar amount of what can get stolen from you is what's ever in your bank account. There's also the credit card issues, but typically it's more what they have access to in your cash account. So in this specific case, she created Excel financial statements for the board, presented all of that information in Excel, and it wasn't anywhere near accurate. So no one saw bank statements, et cetera, et cetera. In that case, she actually charged on the bank statement Victoria's Secret charges. So if someone looked at the bank statements, but no one else had access. So we'll get to that. So sometimes it's going to be very easy to find. So what I'm going to suggest very quickly is that there are three things that I would say that are high priority and things to consider. You could, what you want to do is you want to limit one person from having access. And it doesn't always have to be just pressure. It's just, I can do it. So sometimes if I have a need, then I can just jump in and right and do that. Everyone, I would say all of your executive members should have access, online access to your bank accounts. And oftentimes you can get a view-only permission. And you have to have certain, because a president and a treasurer can collude. So if you have 4 people that are looking at the bank statement, that is a huge deterrent, and you have to do it. So you actually have to maybe come to the board and say, yes, we looked at it. We also involved the firm that I'm at in lawful gambling. The lawful gambling in Minnesota requires the board to initial the bank statements as proof of review every month. So there are things that you really, that's just a very quick, easy thing to do. The other thing I'm going to suggest is that you use a accounting program like QuickBooks and have the online version. So then you can have a deeper access within your firm, in your organization, to actually look at what's being deposited in the bank. But the one thing that this woman also did is, it was a hockey group. They did the Chuck a Puck fundraiser at all of the games, and she said she deposited the cash. It never made it to the bank account. So you can have someone that can kind of be overseeing that. The other third option that is a possibility is, you can always have someone like an outside CPA firm do a quick review on a monthly basis. I do this for a Legion. And what I do is I just basically make sure she's done the bank rec correctly. It matches the bank statement. She can ask me any questions of what she's doing. You have that option too. You could do a quarterly review, things like that. But the most important thing that I can tell you is that someone has to look at the bank statements. And you also change leadership so often that getting people access and signers is not, it loses traction. And all of a sudden your treasurer's been there for 10 years and you've had 3 different presidents and different board members. So always make oversight and review of your bank statements top priority. So there you go.
Thank you, Julie. What we'll do is I'll work with Julie on just sending, again, best practices. We'll get stuff out from Lisa. So thank you both for joining us tonight. Okay, deep breath. We got about 15 minutes, so please bear with us. We got a cool little announcement at the end. So I'm going to turn it over to Associate Director Jayme Innes. He's going to give a Minnesota youth basketball update and talk about a couple other things. So go ahead, Guinea.
Thank you. Minnesota Youth Basketball Alliance, we are closing in on 100 member associations, which is fantastic. So big thank you to all of you for getting registered and being a part of this. The big thing that you're going to be hearing from us a lot, and I'm going to be sending out emails starting tomorrow again, if you haven't seen it already, is with team identification. This is very important in basically the whole process of the MYBA, with making sure we've got the right team entered into a tournament, those results transferring over to trusted rankings. We got to keep that consistency, that uniformity with the teams. So if you come to the MYBA main page, click on team identification. Here's some examples here. Here's the structure. Basically, we need every team to have a unique identifier. We do want to have, in this example, it's Fridley. We got a B for boys, 7, that's what grade they're in. And then we've got a color. Some associations like Osseo Maple Grove, for example, they use a number. Some associations like Shakopee, they just go A, B, C. They've got a couple of 8th grade B teams, and they've got them listed as B1 and B2. But essentially, we just need a unique identifier attached to each team. So what we're hoping that everybody's doing, we know some associations have already done tryouts, some of you haven't yet. But as soon as you know what teams you're going to have, please get those loaded into the MYBA portal. Log in through the MYAS website, click on the Teams tab, and get your teams listed there. We don't have to do rosters at this point. Hopefully you get that in there soon, but the main thing is to get those teams listed in there. And that through that portal will kind of walk you through the proper naming structure as well. So don't be surprised if you're a board member and the tournaments that you signed up for, if their tournament director is saying, hey, we got to get these teams identified correctly. Please send me, these are the divisions that I've got your teams in. Please send me the correct naming. Don't be surprised if you get that. If you're a tournament director, please reach out to the associations that have sent you teams. If they didn't identify their teams correctly, please make sure that they do that. And then also another thing with the MYB is please make sure you get your board members entered into the portal as well, just so when we have meetings like this and we can get them invited and they can attend too. We have reached out, we've set up tournaments for all the tournaments in November that are listed on our website, and set up accounts for those tournament directors to access their tournament in Tourney Machine. So look for those. We're going to be sending that same information out to the December tournaments as well. So you tournament directors can start building out your tournaments. Last thing I'll add about that is that when you get into Turning Machine and you're setting up your divisions, we don't want you to create teams in there. All of the teams are going to be living in a drop-down menu in a list. Select those teams. If they're not listed there, you can use a placeholder team. Reach out to me, Jayme at MYAS.org, and I can request to get that team added, and we'll get that plugged in right away for you. Again, with all this MYBA stuff, I'm going to be sending out an email. Get that out tomorrow with kind of some action items. If you don't have your tournament listed on the MYBA trusted tournaments list, please get that up there as soon as you can. That way we can reach out to you and get your some accounts so you can get access to your tournament. We've got a huge list up there right now, but please get that tournament added as soon as
Is that good, Kenny?
Yep, that's all I got.
Again, reiterate, we do have the Turning Machine webinar recorded that we will get out and have available on the Turning Machine portion of the MYBA site. But there is going to be another webinar on the 21st of this month. We would strongly encourage all of you, and we've been able to get it down to the rock bottom price of $2 per team, but be a part of that ecosystem of the trusted tournaments. So all that information can be available for you, like Jeremy said, with the drop down of the teams, so you can easily select them. The November tournaments, that's why Jeremy's working with all of those tournaments to make sure that we can get those organized. But if you have tournaments in December, January, February, we're hoping that all those teams will be available for you to select. And they'll be part of that whole ecosystem, which will then directly report to trusted rankings, and all that stuff will be available for everybody. So this is stuff, again, that we're going to continue to have to update, because we saw again that Eden Prairie, for example, canceled their December tournament. We're going to have to continue to make sure that we're all on the same page and we're open and transparent with what's going on within your district. And it's on us to make sure that we disseminate that information. So, Jeremy, our roster size is limited to 12.
Yes.
Okay. So, anything else that you want to talk about related to invitational tournaments? Jeremy?
No, that's, I'll just add, ideally, we're gonna, like I said, we've almost got 100 associations registered for the MYBA. We're expecting more to register here soon. As soon as we get more teams added to the MYBA portal, associations adding their teams inside the portal, we're going to get those listed on the website. So that way tournament directors can have one spot where they can check on a team and see if they're eligible. If they're not listed on that site, you know, they still probably possibly meet our team composition guidelines. So there's no rules that say you can't have non-MYBA teams participate in your tournament. As long as they meet the team composition criteria, go for it, get them added in there. We don't want to allow all-star or renegade teams an opportunity to play, and allowing them participate in tournaments or not allowing them participate in tournaments is really the only leverage that we have throughout the season. So if you're not sure about a team, shoot one of us basketball staff at MYAS a message, and we can verify it.
I think the goal though is that as collectively as MYBA member organizations, that's what we want. We want everybody to be a part of the MYBA. So if you have a question and they're not listed as an MYBA organization, this year is a little bit different, obviously, because we have some small outstate associations that don't have the ability literally to do this right now. But we hope that this is going to be the standard, and that we literally are just following through on all the things that all of your great associations have been doing for years. It's just saying we are doing this, and collectively we are the MYBA and we're doing this together. That's ultimately what it's all about, that we can have this strong voice of Minnesota community-based winter basketball. So again,
yeah,
yep.
I want to answer Greg's question. Yes, we did add functionality to allow you to upload your roster. The CSV file's got to be formatted correctly for it to work. But once you go to the Teams tab, add a team, there's a button for roster upload that you can utilize.
If Scott, if somebody wants to answer Scott's, you know, if you guys feel free in the chat with his question about slightly bigger rosters. So, all right, we're going to continue to move on. You guys have known for years, some of the old standbys like Jim Davison and some other people that are around for years. You used to know our stuff as Super Savers back in the day, and we've kind of changed it now to Winter Shootouts. What we're trying to do is shift the format a little bit more to kind of coincide with what Commissioner Tomes and other people are doing. So I'm going to bring on Kevin Wilson. Kev, are you on? Okay. So I know that he was, but I guess in a nutshell, what we're trying to do is we're creating a two game format. And they're going to play their 2 games and get out. So what we hope is that this is, again, a way for you to get games played, and we're trying to control it as much as we can for you know, smaller events, less courts, things like that. And so that's going to be an option. So if it's a supplement, that's great. If it's a way for you to get into some tournaments early on, we're working with trying to secure the rest of the facilities, working with those groups, just like what Rich did during the summer and this fall. I'm going to turn it over now. We've been talking about this 3rd grade concept, and we are moving forward with the league structure. So I'm going to have Clarence come on and just talk about where we're at with that. He's also going to kind of talk about our Rising Stars Academy and the association team development. So Clarence, thanks for joining us.
Thanks, everyone. Appreciate all you guys for volunteering your time at 8:41 p.m. in the middle of the week. Just wanted to kind of give you guys a couple of updates. The Rising Stars Basketball Academy, I'm sure you guys have been receiving some information about that. It's just a total encompassing development program that your association can basically purchase services from. We've been receiving some amazing feedback from parents and coaches and also association leaders with regards to how we've been able to deliver a high level product and service to the kids amidst the pandemic and such. From a third and fourth grade league perspective, we have a ton of time through a partnership that we've created with the National Sports Center to where we're going to have kind of a pre-New Year league, and I'm going to place a link into the chat box. We're going to take 10 boys teams, 10 girls teams, third and fourth grade teams combined. There will be, I think it's over about 5 or 6 weekends, but there's a mini camp with 1 game option in terms of just kind of development to where the coaches and the players are receiving some scaffolded teaching. We'll also run a second session of that after the first of the year. And it's just a really nice way to get those third and fourth grade kids started with kind of less games, more practices. And it also kind of helps us monitor the COVID-19 precautions and kind of keep the crowd and fans at a minimum. So I'm going to keep it really, really short. I'm just going to place a link in the chat box. You can click on that link. You can see the league options. You can see all the other options as well as far as coach development, player development, and the whole 9 yards. And again, we just really appreciate you guys taking out your time and representing your communities. Thank y'all so much. Please reach out if you have questions.
All right. Anybody else want to put in the chat any other tournaments out there that could be on the ropes? Please put that in the chat. You know, I want you all to understand that we are here for you, and so we're going to do what we need to do to get information out for the collective. So if there are things that you want to pass along to myself, to Jeremy, to Rich, to Clarence, to Kevin, and other members of our staff, please feel free. Like Jesse, your thought, that goes along with what we've been talking about as a staff, but that's a great idea. So again, this is something that we need to make sure that we're doing stuff to assist you and to help you through this, not only this year, but for years to come. So again, make sure that you are passing along anything, any other ideas, or anything else that you feel would be beneficial for everybody within youth basketball. So finally, I'm gonna bring this up. We've been talking about the last couple months. I've had a great time working with Craig Perry, who was a former associate director with the Minnesota State High School League. He's now moved on as still consulting with the high school league, but he's the vice president of the U.S. Council for Athletes Health. We've been talking to him and his team about working with them with this trusted health platform, which that'll come. We're hoping to get a collaboration going with Health Fairview. But right now, what we really want to do is get this COVID care package out. And we've been able to figure it out that we've got a structure in place for the fee structure that will be exclusive to MYBA members. So I'm going to have Craig just talk about that really quickly before we go. Thanks for joining us, Craig.
Thanks, Dawson. Really excited about our partnership. And as Dawson mentioned, we have a COVID care package that because you are MYBA in alliance with the MYAS, we can present this to you at a significantly reduced cost. So essentially, all your coaches and athletes, your event staff could have access to our online education course. It takes less than 10 minutes, foundation level of education. And then it gives all of your kids and your coaches and your event staff access to our game day ready daily screening app. And so that is a screening app that allows your kids to let your programs know on a day there's a practice or a game that they're cleared to participate for that day. The good news is that we do all of the management of it for you. So I live in Andover. I'll use Andover as an example of Andover Youth Boys Basketball is using the COVID care package. We can either register the entire organization by email or provide a code. We distribute the daily lists to whomever you want. So you probably have a master trusted health person in your organization, but each coach or a trusted parent with each program can get the daily screening list. As I mentioned, we manage everything for you, take care of building your list and monitoring it throughout the year. And a couple other things too is that when you are hosting games, and when we're at the point where we're able to have some larger events, we do have a QR code that you can scan so that your fans that are coming to your contests or parents can use the QR code right at your event and get the access to the daily screening app and get access to your facility. We also are in partnership with an e-ticketing organization. So if you're going to go the e-ticket route, your fans show up at your event, they show their e-ticket on their smartphone, they slide the screen over and they show that they've been scanned, they did the survey and they're green flagged, ready to go and enter your facility. And then the final components of all of this, and then I'll talk to you about the fee, is that you also have access to our experts, whether it's event management. I spent 25 years in event management at the high school, national, and international level, and you get access to our experts. So for example, the president of our company, Dr. Jim Borchers, he's the chair of the Return to Participation Committee for the Big Ten. We have a doctor here in the Twin Cities who just came back from the women's NBA finals. He was down there as a staff doctor. And another one of our team is the chair of the Pac-12's Return to Participation. So that's just an idea of the medical expertise you have. I listened to you, heard about the conversations about policies and what we can do at our facilities. You have access to our entire staff on reviewing your policies, making sure they're meeting state requirements as well as CDC. So you get all that access, and here's what it gets down to. If I was working, our group was working with an individual organization, the partnership fee would be anywhere from $250 to $500 just to have access to us. And each individual would pay $5 for the screening app and the course. This partnership gives you everything for $3 per person. So you're going to have a 3-month, a little bit more than 3-month basketball season, $3 per participant, per coach, per event staff for the entire basketball season. Gets them access to the course and the daily screening code and all the other things that I mentioned. And so we're excited by the partnership. This is the first youth organization in the nation to partner in this way. We've got a number of Division I Power 5 schools, conferences, D1, D2, D3. The National Junior College Association is one of our partnering leagues. So we're excited to get going with this. We'll be sending more information out to you through Dawson. And then I'll be your point person in contact. And it's our hope that all of you use this. And then when you do have your contest, you'll know on a given day if Andover is at Blaine. The teams have done their daily screening. The event staff are cleared. Even the officials that will be on the courts that day can do the daily screening, and we'll know that we've created a safer and healthier environment. So that's the brief on it. We'll be getting some information out to you, and appreciate your time on a long call on a Monday evening. So Dawson, anything else you want to add?
No, again, it goes back to connecting all the organizations together. So if one association is doing it and the other one is as well, then if they're going to each other's tournaments, that's going to be beneficial for everybody, because everybody's going to be utilizing the Game Day Ready app. We're going to send stuff out tomorrow on that. Craig and I will get that out so you guys have an understanding on what that entails if you're interested as an organization. So we are actually considering that as far as from Scott's point, and I understand that because of us administering youth baseball, that yes, we will consider asking the board of advisors on a separate email, because I believe that they probably would be open to it as well, you know, as we're moving close to the season, to potentially have a little bit bigger roster. The main
Dawson, I just heard back from a couple of our board members and they approved it. So let's go ahead and put that into place.
So right now we'll change that to 15, because I think that's a great idea. And I mean, again, this might be a way for us to pivot away from it, but that's the only thing that may affect it, our awards and the numbers you give out at a tournament. But we all understand and know that there's more to competition than just getting the awards, because a lot of times those awards are just put into a box down the road. But again, we are here for you, and this is a way to enhance community-based youth basketball. So please make sure that if you have other questions, comments, concerns, please make sure to get it to Jeremy, myself, Rich, anybody else on MYAS staff. We're going to continue to get information out. So again, this is not for just you as the leader. It's for everybody inside your organization that's on your board. So please help us by getting your contacts updated on the MYBA portal that you have as an organization. Because again, it's not to just get a bunch of promotional stuff sent out to you. This is so we can get actual info to you that is very beneficial for you and your organization and all your stakeholders within your association. So we want to thank you for being a part of tonight's call. We know it was long, but we wanted to pack in as much information as possible into it. We are going to have a mini summit, and we are committed to it every single month. If we need to have an emergency summit or emergency MYBA meeting, we will do that as well. So we are here for you again, and we are stronger together. So I appreciate your time tonight, and we're probably 17 minutes over, but we hope that you enjoyed it and you gained a lot of stuff from it. This has been recorded. So we will make sure to have it available to MYBA members in some capacity. So thanks everybody for being on tonight, and have a great rest of your evening. Thank you.